What has been the impact on health in the region you've been looking at?
Well, there are particularly direct effects, such as increases in temperature-related deaths, increases in the deaths as a result of extreme events and things like that, which is a particular concern in the Asian region, given that we have so many small developing island states. And even Australia itself is one of the most vulnerable developed countries in the world to the effects of climate change.
In what way? What have been the effects in Australia, for instance?
In Australia in particular, well, obviously there were the increases in health-related, heat-related deaths. Infectious diseases, particularly vector-borne diseases, thankfully our hygiene system here in Australia is very well, so we don't suffer so much from food and waterborne diseases. However, diseases such as Ross River fever and dengue are both of concern in Australia, particularly concerning the environmental spread. Typically it's just found in northern tropical regions of the country. If climate change does continue, though, there is the threat that the regions of these diseases will spread further south, even as far as Sydney.
And is there anything that can be done, as far as you've seen, that can mitigate the effects of climate change on health, or does it simply solve the problem of climate change?
Well, it's actually interesting. Health can both be related to adaptation and mitigation. In terms of mitigation, it is a fantastic motivation for action on climate change. In terms of adaptation, it's one of the main focuses that we need to use, particularly in developing nations, because most of the effects on humans are going to be with their health and their lives.
And it can be very clearly linked, the effects of climate change on health, and I presume there must be some grey areas where you're not exactly sure that the health problems are related to climate change, or is it easy, is it possible to do that?
That depends on who you ask, frankly. There has been research done that has shown that, for example, this isn't in the Asia-Pacific region, but from the European heat wave, there were tens of thousands of people that died that would not have died if it was not for that health effect, if not for that climate effect. So obviously there will be skeptics out there that will disagree with that, but there is research being done and it has been shown that it does have a detrimental effect on our health.
Okay, great, thank you.
No problems.